just kick this off, I apologize. Georgia Pollen has won the battle, and I have officially lost my voice. So I am going to try to speak. I usually speak real fast, but I'm trying to go a little bit slower. And I apologize if you can't understand what I'm saying. But I just want to welcome everyone. I'm so excited that we're doing this. It's been a long time coming. Just super excited. I want to welcome everyone who is within the North American Dental Group family and everyone who is not in the North American Dental Group family who is listening in on this. Again, my name is Dr. Farah Kar. I am an orthodontist and I practice in Atlanta, Georgia. I've been practicing for about 5 years now. Orthodontics is a second career for me. My first career was in architecture and development. So I'm an art major. And I tend to just always focus on the art of things. So I'm very passionate about art, but I'm also extremely passionate about anything to do with partnering with other women and the empowerment and leadership of women. And so just so blessed to be a part of WIND, which is Women in Dentistry, which is a group that was founded a few years ago originally for women within North American Dental Group, but this is kind of our first event opening it to outside dental professionals, really to support us, to grow us as leaders, just so that we have this amazing network and share knowledge with each other. And so, it's still in its infancy, but we're so excited. We know there's so much potential. And so tonight we have really people who are listening in that may be dentists, dental hygienists, office managers, just all these different members of our kind of dental family. And so we want this discussion to be very informal. And we have 3 amazing doctors with us with a world of knowledge and experience. And it's going to be a very informal discussion for about 30 minutes, and then we're going to have some Q&A at the end. So I'm going to just dive right in. I'd like you guys, to our beautiful panelists, to introduce yourselves one by one. I'm going to start with you, Dr. McGuire, if you would like to just quickly introduce yourself, tell us a little bit about yourself, and then we'll go to Dr. Warnock and Dr. Hollis.
Hi, I'm Dr. McGuire. I'm sorry, I'm in the car. I'm running late from everywhere, and I had to take my daughter to urgent care, so I got stuck in there. So I apologize to everyone.
Anyway. No worries. Is she okay?
Yeah, she's okay. It's like the doctor mom life never ends,
right?
And the balance. So,
right.
But I'm Dr. Anna McGuire. I'm out in the Dayton, Ohio area. I am a general dentist, but I do a lot of surgery. As a matter of fact, I have to go back to the hospital again tonight. It seems like I live a second life outside of the office and at the hospital. I take care of all different kinds of, I'm on the heart team at the hospital, so I'm clearing patients and getting them optimized for surgery, with the heart team, with the head and neck cancer team, with the trauma team. We do everything pretty much there. And then I'm the regular mom. It's like when you have no time, you're running to urgent care with your kid because they need to hear it from a real doctor.
So true.
It is. I get it. Mom, I know you're right. Don't tell me you were right. I just need to hear it from someone else.
Sure. Well, we're glad you made it. You made it. You're multitasking again. Please be careful. We're so happy that you're able to join us, and we're happy that your daughter is doing okay. Dr. Warnock, we'll pass it to you.
Okay, well, first of all, Dr. McGuire, listen, girl, breathe. Just exhale. Just exhale, okay? Because I feel it. I mean, I've had this big, gigantic smile just watching you the whole entire time because honestly, I think that like you are the epitome of what all of us are here for. This is like the whole purpose. Like you're actually showing it. You're live and in person. kind of expressing what we all experience. So take the moment, breathe. Please drive safely. Please drive safely. Okay. Don't look at the screen. Don't look at the screen. Okay. So, so, so that aside, because her personal well-being is very important to all of us. I'm Dr. Anna Warnock. I am from the Steubenville, Ohio region of the North American Dental Group. But Steubenville, Ohio is actually where I grew up. I'd actually practiced in Columbus, right down the street from where Dr. McGuire is, in Westerville, Ohio, for several years. Prior to that, I was actually in public health at Third Street Family Health Services. I was the director of their clinical program there and part of their outreach program with their dental students. So I was at one point in time an adjunct professor there too at The Ohio State University. So found my way back home. Family brought me here. Strong ties brought me back here. And I am the regional dental director for the Steubenville region. For NADG. So
Awesome. Thank you. We appreciate you being with us.
thank you.
Awesome. Dr. Hollis.
So I from the Lombard office. I'm from Grove Dental. We joined 2 years ago. As a matter of fact, April 2nd, it'll be 2 years. I'm the dental director of one of our 4 practices, the Lombard location. I've been practicing since 1986. I have a hygiene background, dental hygiene, and I'm very passionate about dentistry and women in dentistry. So I'm past president of the West Suburban Dental Society and have made a lot of contacts and always encourage women to continue because the landscape is changing for us and the amount of women that are graduating from the dental schools today. So it's very exciting.
It's
very
amazing. It is. It's actually quite amazing that how much things, if you look at kind of a timeline, when you look at, 5, 10, 15, 20 years and how that's suddenly in the last 10, 20 years, there's been such a huge change. Obviously we need more change, but it's been amazing to watch. I'm going to jump in. I have some really casual questions that I want to ask you guys, and you can really answer as quickly or slowly as possible, but I'm going to kind of just fire away. And I love that, this is not pre-planned and you may have given some of this some thought, but I really want you guys to talk from the heart. Keep in mind there are people on this call with us, on this webinar with us, that may still be in maybe undergrad and trying to think about what they want to do. And so if you have pearls that you want to share throughout any of this, please feel free to do so. Dr. Warnock, I'm going to start with you. Who inspires you?
Okay, so I would say I have several inspirations, and it doesn't come from places that I don't want to say I'm abnormal like this, but they just come from regular everyday experiences. Like, I'm not the type of person who looks big. I can acknowledge and that there's superheroes and things like that, but I'm more of a grassroots kind of person. So the people that I'm around on a daily basis. So, the people who inspire me are like my mom. I mentioned earlier to this panel that my mom has since moved in with me. Like, she's an inspiration to me because, she has done so much. And now that, I don't want to say the roles are kind of reversed with, she had taken care of me for so long, and now we're kind of in that opposite kind of spectrum. But
right.
Man, it's so humbling and so inspirational to just see, wow, what she put down, and what she sacrificed for us. And then now we've come full circle, and here we are, this group of women, all moms, and now like what we sacrifice, not just for our children, for ourselves, for our profession. So, just very grassroots is what is basically what inspires me. The people that I work with, you know, they're huge inspirations to me, and in ways that it's like, it is so humbling to be around people that, you know, my assistants, I see how my assistants struggle, and I see what they do, and how they make things work, and how you just watch it happen. And it's so inspiring, because it's like, wow, you know, that's amazing to me. So yeah,
It's a family.
it really
It's a
is.
family.
It really is.
I think most people I know, when I was in dental school, I never realized how many hours I was going to spend with this family.
Yeah.
You know, I think when it comes down to it, I know my staff and I, we're together more than my kids get to see me during the day.
Absolutely.
So they really truly become family. That's awesome. I love that answer, because it's so raw and so true. And I think most of us, you know, of course there's obvious answers, you know, of people that may inspire you, but I think a lot of times it's exactly what you just said. It's the person that it's right next to you, living with you.
Yeah.
Thank you for that. I appreciate that. I noticed, Dr. McGuire, that you're sitting now. That was a smooth transition, girl. I saw you running quickly through your house. You're like, do not talk to me. I'm going to the room. So
I know.
you're getting the next question. You are smooth. I love it. Our next question to you is, what is the biggest accomplishment in your career or in your personal life? What is, you know, I'm sure there's more than one, but what would you go with?
I can't even think, you know, and I always say, I can't think about it, because I always feel like I get an accomplishment or I achieve a goal. There's always another goal. There's always something else. So I can't ever say that there's something that is the biggest, you know. It's not really a bigger, better deal coming along, but there's always something, you know, it
Right.
never ends. I used to think when I was a kid that, you know, the goal is finish college, goal is to go to dental school, goal is finish residency, goal is get a practice established. You know, you think it never ends. So what is the biggest goal? You know, other people will look and say, oh, you have your practice. Oh, that's great. You know, but I'm already looking like 10 steps beyond that. And we're always doing that. And I don't know if sometimes it is part of the multitasking of being like the mom, and you're overseeing everything, that you don't even look at goals and think that, oh, wow, that was such a great accomplishment. You're just like ticking it off your list of, oh yeah, I did that. Okay, next, let's go. So yeah, I don't think
that other people, like, you know, when like people read your bio, they're like, yes, I read your bio and you did. I was like, you read the bio? That always just astonishes me that someone would like take the time to do that. Do you ever feel like you kind of take a step back and you're like, I did all that through someone else's eyes, but you're just so busy doing it.
That's
right?
exactly right. We're living life like the moment right now. And I think that's why I don't really get caught up in it. Like sometimes you know, my kids are the ones that usually tell me, Mom, did you know? Or I hear them talking about things, you know, like one of the biggest things, I guess, as I'm looking around is back when I was a teenager, I was an alternate for the Olympics. So like, I'll hear my kids talk about that. And I was like, yeah, that's just nothing. It's no big deal. And you brush it off. I'm a dentist now. Like that was like a past life. So I don't think of those things.
Yeah.
And that's like, even in the hospital, like we'll talk about, oh, I'm doing this surgery, or I'm doing that surgery. And I don't even think about those things because it's just become the norm for us. And we just move on, you know,
you kind of overlook or forget how badass you are.
Apparently.
Sorry, I'm a potty mouthy girl. Well, I agree with everything. Dr. Hollis, you're next. Your question I find and I'm sorry, but I think it's one of the hardest ones. At least for me it is. What has surprised you most about being a dentist?
Ooh. I think the way that I think women approach dentistry, I think is way different than the way that men do. And I think we are very relationship oriented, and we want to know about our patients. And I'm not saying we care more, but we get more involved with our patients, and we get to know them. We get to know their families. We get to know what they want. And that is so important. I mean, I think people are sometimes hesitant or don't think that we would want to know. So that has been the biggest surprise, or the most exciting part about dentistry, is just knowing my patients, knowing as much as, they'll share, or, what's important to them and what their goals are. And that makes me feel like I can be a better dentist. I can provide them with better dentistry because I get to know who they are. So we always think of dentistry so methodical, take care of the emergency, the urgency, and, our order of how we do things. But it's really our patients that are guiding us. So I think that's so important.
The human connection.
Mhm.
It's I don't know about anyone else, but I know when I was in dental school, you're so nervous about the process, you're learning things. So I remember my faculty telling me, first you're consciously incompetent, then you become, no, it's unconsciously incompetent, then you become consciously incompetent, then you become consciously competent, and then you become unconsciously competent. And I think that's when you've gotten so good at what you do that you don't really need to focus so much. And it's so much easier to see the person, and you start to focus so much more on those discussions before, even during and after the procedure, right?
Yes.
And it's the little things like, oh, Julie's graduating next week. Oh, okay. And then you see them next time, you're like, oh my God, show me the graduation pictures. Just all that stuff is crazy, how your patients become family.
Absolutely. And when they're comfortable with you and they know that you care, and we all care, we want to be perfectionists. We work in millimeters. Everything has to be perfect.
Right.
And they're just appreciate we didn't hurt them. And I think that's just so important.
Absolutely.
That human connection.
Yeah. And it's built on trust, right? It's built on trust, and they share. And gaining that trust takes time, and it takes work. So that's awesome. I appreciate it.
But I think if you develop that trust from the beginning,
yeah,
and want to know your patient, know all about them, it just makes it so much easier. And they're your patients forever because they know you care.
Absolutely. Absolutely. Thank you for that. Let's go back to you, Dr. McGuire. What advice would you give to a woman graduating from dental school and starting her professional career?
Oh my gosh. That's funny because that's funny
I've got
because
lots of things to say to this too.
I've got
Me too. Why didn't you ask me
Whatever
that?
you want to say. Listen, whatever you want to share. Just
hello. It's funny because I had today, I was in the clinic and I had an international, a female dentist from India who's trying to become an international student here. So she was working with me in the clinic. I had a Indian doctor who was an international student working that we're mentoring, who was in the clinic with me. So we were all talking about everything, and they're in different stages in life, from 20s all the way, to me, the old self. And so we were sitting talking, and the thing that I would say is you can do it all. I remember when I was in dental school, or even going into dental school, In my mind, I always thought I could do it all. I was still the kid who never saw, and I still am probably that same kid who doesn't see a barrier from being a female versus male. I just think you're a doctor. I don't see a barrier because of age. I don't see a barrier because, I'm mixed race versus the Caucasian versus, the African American. I don't see any of that. And I think the biggest thing is not having those barriers in your own head. You can accomplish anything. If you want to own your own practice, if you want to be the CMO of a DSO, if you want to be king of the world, I don't care what it is. If you don't put those barriers in front of your own self, you can accomplish anything. And really, it's all about hard work. I don't care what family name you have, what money you have, put your hard work, get your nose to the grindstone, make a goal, and then achieve it, and then go on. And then when someone asks you, what's your greatest accomplishment, you have no clue because you haven't made it yet because you're still going.
Yeah, absolutely.
Pretty much my goal would be on time.
Well,
at this point, I haven't accomplished it yet.
What I just realized is that, and I refer to you as Dr. McGuire, I refer to you as Dr. Hollis, but I'm just now looking at this screen and I'm like, we're all Annas. There's like Anns across the board.
Yep.
I'm like, I think that's pretty impressive. I agree with you completely. And honestly, we're very similar in that thought process, because I was brought up exactly the same. No barriers. Like there was no difference. There was no, this is a boy job, this is a girl job. There was that didn't exist. And to me, it was exactly the same too. Like my race means nothing. Like that's not I'm sorry, that's not a barrier to me. Like what do you mean? What do you mean because I'm Asian that there's okay? What do you mean that I'm okay? Like, so I totally appreciate that. The one piece of advice that I would add on to that, in addition to you can do whatever you want, is to take a step back. And this is just now 45, 46, I don't know how many years in the making, is enjoy the journey. That's the one piece of advice that I would take to anyone who's new, who's coming on, who's considering coming into this business, to this practice, to this lifestyle, to this life, is, we do get real busy. All of us get really busy. Okay, we're like, same thing, checklist, tick, 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 tick. Okay, this next. Oh, okay, well, I'm going to go ahead and achieve this goal. I'm going to achieve this goal. And that's great. But at the same rate, like, enjoying the process of getting to the end of that is the one thing. Because I know that there were a lot of times where I was so busy getting to the end that I kind of like looked back and was like, oh, I did this thing where I was in between jobs and I was pregnant. I had my child and I opened my practice, all within like a 6-month time period. And I don't want to say like I didn't pay as much attention to my child as I did to opening my practice, but we get into that tick, tick, tick thing, and like I'm toting around the kid and we're going and we're picking out furniture and we're, doing all of that. And then I look back and I'm like, dude, I didn't just like hang out with my kid for a couple times. I was dressing, putting her in the bin, and we were on our way. So, just taking a moment to reflect on that. That's the one piece of advice that I would say, I wish I did take that step back and appreciate some of those landmarks a little bit more.
Absolutely.
And I would like to add one more thing to that. And when we talk about hard work, but it's hard work with a sense of purpose.
Yeah.
And that to me is what you feel it, when you have a sense of purpose and why you're doing what you're doing. You love what you do, but it's with purpose, and that makes it so much more enjoyable. So.
Absolutely. It's so funny, just hearing everything that you guys just said literally came up in a discussion today that I had with a with someone who was shadowing a pediatric dentist next door. She came over and she said, "Oh, I follow you on Instagram, blah, blah, blah." And she started crying. She said, "I'm 30. I haven't finished my bachelor's, but I want to do what you do." I like literally took her by the shoulders and I like shook her. I was like, "You want to cry, cry." I cry at least twice a week just because I want to. I was like, "You want to cry, cry. You want to feel scared, feel scared. You want to feel like everyone's smarter than you. There are going to be probably a lot of them that are, but that doesn't mean anything. Do not let that paralyze you." And I think with everything that you guys just added, I would just, for me, it's always the fear. I always have fear. What if I'm not good enough? I'm an art major. I never took science courses. I'm just different. I'm not da da da. I don't memorize as quickly as everybody else. And just realizing that the fear is like this little companion that's always with me, but it doesn't guide me. I'm like, cool, calm down, but I keep it moving. You know what I mean? And so that's such great advice. I know we had a question here. I know we're not really at the question answer point, but I think this just kind of really relates well. We have a question. It says, any advice to newly grad dentists who are becoming moms? That's a really hard time. I know it's a confusing time with all the pressure that we have on just being a woman, being a mom, being whoever, these roles, these predetermined things. So what advice do you guys have for her?
Oh my
Well,
God.
I'm a
Yeah, go ahead.
godmother. I'm a godmother. I have lots of godchildren.
Oh,
But I think this career allows us to have balance and to figure out that work-life balance. More than we know, more than we think we know. So I think being a new mom, I can't even imagine having a baby and worrying about work, but I'm just saying, to try to really, I guess, talk to you moms and say, like, how do you balance that? But I think this career allows us to do that. And the ADA, and I mean, I have a whole like articles that are just coming out on that work-life balance. That is the focus and is our focus. And it's important, it's out there. So, but let's hear from the experienced ones now.
Well, I would say my thing would be, again, and back to the journey thing is, appreciate what you have. And honestly, to Dr. Hollis's sentiment is, we do have the luxury of being in a profession where there is the ability to have balance. And when we get out of balance, it happens because more often than not, it's self-inflicted. We put that pressure on ourselves. We're like, oh my gosh, I have to do this. I have to do this. Oh my gosh, the baby is crying. I can't sleep. All of these things are just jumbling in your head. And, once and as a new mom, let's face it, you're exhausted. Like, you're like, hi, I haven't slept. I don't know about all of you guys, but yeah, I know, I got a little thing going on there. So I think that what my takeaway would be is, enjoy the journey, rest when you need it, give yourself a break. Don't expect too much from yourself, and take the help. People are going to be people love babies. People love babies. So take the help, give yourself some time for yourself. And then I get from the dentistry aspect, because I've had several new doctors that have come to me that are female, that are like, oh, I'm worried because what about my hand skills? Because, when you are a new doctor, your hand skills, it's not just like riding a bike for some of us who've been in this for 20 some years. It's like, oh, wait a minute, crown prep, okay, wait, what do I have to do here? Okay. It's a little different. So again, back to the appreciate the time that you have, because that small human being is never going to be that small ever again.
No, it goes so fast.
I know.
I'm blinking. I have a 24-year-old, an 18-year-old, and a 16-year-old. And I was in dental school when I had my 24-year-old, and I was in my last year, and I can remember trying to study for part 2 boards, and he's crying and I'm crying, going, I'm the worst mom ever. I need to study and ignore you. You got to be with your father so that I can say, and it's hard. And the balance is hard. And I don't think that a lot of people appreciate that we're the mom. It's a working mom problem. You have the guilt that you're not there, but you have the guilt, I've got to do this. And sometimes, you know, we think that the men don't have those same guilts, but they do too, because they don't want to miss, you know, the first steps, and they don't want to miss a baseball game, or, you know, a cheerleading, you know, or pictures with their hair up and all this stuff. And we're worried about every detail, because that's why we're dentists. We're a little OCD. We worry about every single detail in that kid's life, in our practice, in everything. And we don't want to miss it or be wrong, or accept the help like we were talking about. And I think for the new doctor out of school going into practice, you have to accept the help. That's the hardest. And I think that's something along the journey when you hit your 30s and 40s and you have those decade changes. It changes. It's like the changes of, I don't care what other people think anymore, as far as, personally, or you start to get, I don't care about this or that. And, you reprioritize everything in your life. As far as dentistry, we already know those things, they're always at our top priority. Getting those margins just perfect, getting the perfect impression, the perfect scan, the brackets that are on, they knock the brackets off. I told you 5 million times, don't eat sticky chewy. I mean, you go through all those things. The things that we are never, prepared for is the parenting, that we have to deal with. No one tells you all the details, and we're all learning along that journey. Like you said, we have to appreciate, but we're learning, and we want to be perfectionists at it. And that's the problem that I think we all have. We have to just relax. I mean, because we're not perfect parents. I am for sure not the perfect parent. I mean, obviously, I'm running to urgent care. I'm still in scrubs, got to run back to the hospital. But it is, and then you've got to take that help when you can and enjoy it. And it's all good. The biggest thing I tell my kids all the time, it always works out exactly how it's supposed to, no matter what you think, it will happen exactly how God has intended it for it to happen. And just relax.
And I would also like to add, get involved early with organized dentistry, with your local dental society, because that's where you're going to network with the people that are going through the same thing. And I think that's so important. I got involved very late in organized dentistry, and I have classmates that are past presidents of the Chicago Dental Society, where I'm just past president of on the local level. And the support there is just wonderful, being a part of something that everybody else is going through. I couldn't encourage you to do that more, or encourage young dentists. The meetings are maybe 4 or 5 for the season. You get CEs, but you get to talk to colleagues and really connect. And I think that's so important.
Absolutely. So important. And, being involved with things like this, I think is so important, because you have this huge resource to, to basically use and allow the guidance of others to help you within, our group here, which I love. It's funny, I have a couple patients that are high school counselors. And so they see all sorts of things, very unfortunate things. They deal with a lot of mental health issues, and we're always talking. And I have 2 little girls. I have a 2-year-old and a 1-year-old, well, 2.5 and 1.5. And I'm always like, what can I do? I work a lot. What can I do? Is this something I can do to prevent, these issues from happening in the future. And they all tell me the same thing. It's modeling. You're modeling behavior. You know, if you want to raise kids or whoever, if you just model that. And I feel like that also applies to our teams. If you want to be a compassionate person, then you need to model that. If you want to be someone who is approachable and relatable and you want your staff to be loving and caring, you need to model that. And it's the same for when you're a new mom. You're just doing what you got to do. Just model the person you want to be and pick and choose. We don't have to do everything at once, you know? And I think back to what you were saying, Dr. Hollis, about life-work balance, which is still this crazy ongoing discussion. It seems like almost anywhere and everywhere. I feel like that balance changes over time. What may be okay for me when I first had my babies it has changed now. 2 years has just gone by. So it's hard, and it's an ongoing thing. I don't think anyone ever says it's like happiness. Like I've arrived, I'm here, I have balance, and then it just stays that way. It's not like that. You're constantly having to calibrate your life to maintain that. I appreciate that. Just really quickly, I know we're kind of running short on time, but I really want to get to this question. And it's open to all of you. Are you a mentor, or are you do you belong to any group that supports young women and girls specifically? And if so, how are you involved, and what inspires you to do that work?
I do support the Girl Scouts. I could probably do more, but I'm also involved with the DuPage Senior Citizens Council, which is Meals on Wheels and completely a whole nother spectrum. But I try to mentor my patients, young patients, every day, just by asking them, you know, what they're doing, what their concerns are they in school, you know, they're taking a semester off, whatever, just getting engaged with their concerns. And everything doesn't have to be done. You know, we don't have to finish college in 4 years. You know, you can take those breaks and do what's best for you. It's different today if we can look at everything differently, you know, and stop thinking what the norm is, and I'm supposed to do this at this time and this time and this time, and just do what's best for you and what works for you. As you said
That you said that. I love that you brought that up. I don't know about you guys, but you know, I think sometimes, like for me, Dr. Weiss is an orthodontist. He still practices in Toronto, Canada, where I grew up. And he was the only doctor that I can think of growing up. And mind you, I had a 7mm diastema. He was the only person that talked to me and asked me about me and told me I was smart and told me that I'm capable of anything and just motivated me like crazy. And here I am at 40 talking about Dr. Weiss, having braces at the age of 11. You know what I mean? And he doesn't even know it. I can't wait to go back and find him and tell him I'm an orthodontist because of him. But he changed my life. And it was just like conversations in passing. He probably did that to every kid, but he made me feel so special. You know, so I love that. I love that you touched on that. I think so many of us do that throughout the day, but we don't even focus on it because it's not some structured program. You know what I mean?
Yeah.
That's awesome.
Well, you're just being authentic. I mean, really, and I think Dr. Hollis even touched on it, and so did Dr. Warnock. We just are dentists and we want to help and we want to get to know the patients. And sometimes those patients come in, like you were the patient of Dr. Weiss, and, you know, he's really getting involved in your life and making some comments that resonate and stick with you forever. And look, now you're the orthodontist. And I think that happens more than we really realize, because little girls sitting in our chair, you know, they come in and we're doing a quick exam and we might not think anything of it. And they're looking at us like, wow, you know, she grew up to be whoever she wanted to be. You know, that's like one time we had a little girl in our office, And I had a male hygienist at the time and a male assistant. And they said something to me, and I said, little boys can grow up to be what they want to be just as much as we can grow up to be who we want to be, because
Absolutely.
they were so shocked, but it's true. And I think the comments that you make to them, you know, it'll resonate, and you just
Yeah.
never know who you're going to touch in your practice.
So I'm going to touch on this, and then I'm going to go down a rabbit hole, and I apologize because this is what I talk to my kids, that my patients, my own children, is about the tooth fairy. Since you decided that you wanted to bring that up about the whole male dental assistant and male dentist. So I, on a regular basis, will talk to my kids about, hey, you know, the tooth fairy is going to come. And I try to give parents a little bit of an out, because the first thing I say to the kid and also the parents is, I'm like, listen, the tooth fairy system is way different from Santa's system. Okay. Santa's one dude and he's got a bunch of elves who work underneath him. I said, but the tooth fairy is a totally different circumstance. You got fairies on call. Okay. And depending on what fairy you got, if that fairy's on call, they're not all created equal. And then the one thing that I always say to them is also, tooth fairies are not always girls, just so you know. So you can get a boy tooth fairy, just
That's awesome.
gender equality. And that is honestly, that is one of the things where the kids, they will come back and they will remember, you're the one who told me that the tooth fairies have a residency system where someone's on call, first of all. And second of all, you're the one that told me that not all tooth fairies are girls. And it really does. It changes a lens. It changes a perspective. And it really comes back to, I think, where Dr. McGuire, where you and I were talking about earlier, is that it's like, we don't understand barriers. Like that doesn't even there's nothing in here that even acknowledges that. And sometimes it takes articulating it at that simple of a level to break it down at that young of an age. And so, you know, as far as like, you know, involvement with girls groups or anything like that, you know, I personally have involvement with, of all things, survivors of sex trafficking in this area. But these women have so much that has been put on their plate, and to see their life experiences, and to just, you know, I've spoken to other dentists before. I said, you know, these women have these problems, and just by your gender alone, you are taken out of the ability for them to even be near you, because just your gender alone. And so, you know, having that conscious effort of being able to de-escalate the fears that they have of just being alone or within 5 feet of you in a room, you know, to be able to work through that with them, and to be able to acknowledge that, and to have the empathy and have the understanding, so that they can move on and try to heal. And so those are all things that I think, you know, when you're asking about being able to mentor young girls, children, young women, you know, I think it's just, I think at this level of where we are at, it's a matter of just acknowledging it and just trying to support people regardless of who they are, you know, just be supportive.
Yeah. Absolutely. Model it.
I like the model word. It's a good word.
Modeling.
I do too. And I like the idea of, you know, just asking and listening. I find that if people know that I'm willing to listen and that I want to listen and not preach to them, or, you know, I want to be there to listen so I can understand. And people want to be heard. When they open up to you, they're asking for help, and they're asking for empathy and understanding. And I think that's just great that we can take the time to do that.
Absolutely. Didn't they say, I had done a workshop once about, you know, de-escalating situations, like, you know, if there's conflict in the office. And I remember the speaker saying that one of the, you know, in a situation like that where someone is upset, one other than just like being hurt, you know, which is the root emotion of anger, it's that they're not feeling validated. They're not even feeling hurt. You know, you can say all these words, but, you know, recognizing someone and seeing them as a human and validating their emotions and really them feeling like you're listening to them is so important. I have to try to wrap this up. So I'm going to wrap it up in a short way. Okay. And this was not ever discussed before. So just roll with it.
Right
I
on.
want you guys to just each of you are going to throw out 3 words. I don't care what they are, but I just want you to pick 3 words. Okay. That could describe you. That could be your favorite food. I don't even care. Just 3 words. And we're going to start with Dr. Warnock. Go.
Integrity.
Okay.
Oh, you want me to do? I
I
thought.
want 3. I want 3. 3 each of you.
Well, I thought you
Integrity.
were going around the moon. Like you wanted one from me, one from Dr. Hollis, one from Dr. McGuire. Okay, I see.
No, I need you to wing it.
Okay.
Integrity.
Integrity, humility,
Okay.
and happiness. Those are mine.
She took some good ones, guys. You can't use these again.
Yeah.
Sorry. All right, Dr. McGuire, what do you have?
Oh my gosh, she took all the good ones. I'm
I
left with
know.
tacos, margaritas, Fridays. Can we keep on going?
Yes. Yes and yes. All right, Dr. Hollis, what do you have?
I would say passion, empathy, and being grateful. Grateful.
Y'all, you guys are just next level. That's full circle right there. You know, because I was hoping someone would say margarita. Seriously. I'm so grateful. I know, I don't know if anyone else starts their morning huddles with grateful. I know here we do, and I absolutely love it because no matter how insane your day is and whatever's happening, I can always think of something to be grateful for. Someone's asking, what is my 3 words? I would say positivity, Beyonce, and caffeine. Those are my 3. I don't know why, but that's where I'm at right now.
That's
So
because you have
I'm
2 young babies.
I do. I have one that's about to turn 2 and one that's about to turn 3. They're 11 months apart. And so my goal in life, and I know that your you know, our patients is, I just want, if I die one day, I just want someone to remember and say, she was an awesome chick, and hopefully it'll be my girl. So that's kind of how I lead and live my life. But I am so grateful for the 3 of you. I know what it took to give me some time this evening. I know everyone that has listened to you guys has definitely enjoyed hearing your wisdom and your pearls. And you guys are just some serious powerhouse, bad beeps. And I'm just so honored and proud. Thank you so much for doing this tonight. I really appreciate it.
Thank you.
Thank you.
Being
Thank you.
Thank you guys. I don't know how to end a meeting. So I literally we just need to all turn off our cameras.